Rodgers Achievement Award is presented to the Health Center primary care clinician who exemplifies excellence in clinical practice and leadership. The award was established in 1977 in honor of the late Dr. Sam Rodgers from Missouri, a physician and national leader in healthcare and civil rights. Our honoree is Dr. Jocelyn Pedrosa, Chief Medical Officer at Yakima Neighborhood Health Center in Washington State. Dr. Pedrosa began service at the center when it recruited her in 1976 as a sole pediatrician. Since that time, the center has grown from 3 to 10 primary care sites in Yakima Valley, reaching out to nearly 100,000 patients. It provides an array of health services, including dental and behavioral health, but also targeted support programs offering medical respite care and housing for the homeless. As medical director, Dr. Pedrosa has recruited an innovative clinical team to keep pace with the growth and the health center's initiatives to meet the greater needs within its communities. During the many months of COVID, she also has become trusted and a familiar voice within the community, helping counter misinformation about vaccines and urging patients to protect themselves and their families. She also successfully led a major initiative at the center aimed at reducing dependency on opioids. Dr. Pedrosa's passion is to lift barriers to care for the many who suffer hardship, poverty, and discrimination, and she's done her job well. Today we recognize her service and present her with Nachc 2022 Samuel U. Rodgers Achievement Award.
Thank you. I am deeply honored and grateful to receive this award. The award that the work that this award celebrates is really the work of so many individuals at Yakima Neighborhood Health Services. And today I would like to remember a former patient of mine. Let's call her Sarah. Back then, Sarah was a 12-year-old with horrible, uncontrolled asthma despite many, many medications. I suspected that she wasn't taking her medications as she should. Well, Sarah showed up at the clinic one day and shared with me that she hadn't had symptoms in several weeks, which is a first for her. I was thrilled. I congratulated her and quietly patted myself on the back. Unfortunately, my victory lap was soon to be cut short quite abruptly, as I would soon learn that the reason why her asthma was under control was that she, her little brother, and her mother were now living in a shelter which didn't have any carpets. Her abusive father had finally gone too far, and in a fit of rage, had broken several of her mother's ribs. They fled in the middle of the night, leaving everything behind. They were at the clinic that day, requesting medication refills. That was a truly sobering moment for me. However, in short order, I was able to have a member of our behavioral health team in the exam room, helping that family process their trauma. An outreach worker was deployed to explore housing options for that family. I had the relatively simple task of renewing her prescriptions and sending it to our 340B pharmacy. I felt very proud and fortunate to have the resources to help this family that day. Stories like this play out at YNHS and at health centers across the nation every day, because clinical excellence is possible when we lift that veil of inequity and injustice, see the barriers that our patients face, and do not flinch. I therefore share this award with my many coworkers at YNHS. I also share this award with all the patients who make the choice to show up, often at the expense of work, school, and income. My CEO, Rhonda Hoff, who many of you know, taught me two simple things. Number one, never let perfect be the enemy of good. And number two, Jocelyn, that glass is half full. Now there are days, Rhonda, when that glass sure looks like it's half full of rat poison. On most days though, that glass overflows with life-sustaining water poured by our patients, our board of directors, and our coworkers. Thank you.